So Epcoritamab was recently allowed to sort of given hints of approval in patients with relapsed refractory follicular lymphoma. As of right now, we currently have mosunetuzumab as a bispecific antibody in relapsed refractory follicular lymphoma, and epcoritamab based on some data from the follicular lymphoma patients treated in NHL1, again was subjected to allowed to get an indication in this patient population. So what we did is take a look at patients traditionally treated with chemoimmunotherapy in the second line and beyond, and compared that to the information we had from epcoritamab from the clinical trial, and tried to get a comparative assessment of how epcoritamab will compare in that patient population, will it improve any patient outcomes as compared to chemoimmunotherapy in patients who are treated in the second line and beyond follicular lymphoma. Again, this is a very early sort of evaluation of this data set, and then obviously because it is a retrospective data set, there's quite a bit of confounding factors in this situation. Obviously, we do know there's probably a subset of patients with follicular lymphoma who will not necessarily respond very well to subsequent chemoimmunotherapy, and there are some obviously who have very long responses to initial therapy and who upon retreatment will again have very long responses. This also tries to take into account some of the novel treatment options that are available to patients in that second line and beyond, like R-squared. We did have the PI3 kinase delta inhibitors, but these are no longer available. But for a certain period of time, these were options people in the community had access to and could treat their patients with follicular lymphoma. So all in all, this just suggests that epcoritamab fares favorably well against those other options in patients with relapsed refractory follicular lymphoma, especially when we look at third line and beyond, which is sort of an area where there is still an unmet need for treatment options for most of these patients. Now, this does not take into account, obviously, CAR T-cell therapy, which has an approval for Tycel and Axicel, and more recently Lysocell for patients with follicular lymphoma, and it does not take into account mosunetuzumab, which is also approved for patients with follicular lymphoma. Again, this historical sort of retrospective analysis just really looks at chemoimmunotherapy and some of the novel treatments that were available over the last several years. But again, it will have to be reevaluated at a more sort of contemporary sort of time frame with the advent of all these newer treatment options, as they will likely extend the response rate and the overall response duration for these patients with follicular lymphoma.